Hi, thank you for asking me to come and speak to you today. My name's Claire Constantinou and I'm a gastro-dietitian at University Hospital of Wales in Cardiff. So I had a chat with my team before I came today to sort of have a think about what you guys might want to hear about. It was a really long list and I've got 45 minutes and she wants me to leave questions at the end. So we're going to try and get through it all and hopefully there's things in here that will be of interest to you. I'm happy for people to put their hands up and ask questions as we go along. But if it's something I know that's going to come up, then I'll say to you, we're going to move on to that in a minute. So today we're going to have a little bit of a think about the dietary principles for liver disease, so healthy eating and bone health. A little bit about maybe symptoms and side effects, and is there anything diet-wise that could help with that? Special diets, herbal remedies, coffee, magic foods, a little bit about that as well. A little bit about weight loss as well, and then a tiny little bit at the end about advancing liver disease and how the advice might change. And hopefully, through the process of talking about these things today, you'll get an understanding of who might need to see a dietitian. So, what is healthy eating? Well, it probably varies depending on each individual and whether you have a medical condition. This is the Eat Well Guide, and it's national guidance, and it's based on populations as a whole. And if you have medical conditions, it may mean that you need to make adaptations to this to make sure that you're retaining good health with your medical condition. It's about having the sort of best healthy, balanced diet for you. But ultimately, the aim is that you want a balanced diet with a full range of vitamins and minerals to make sure you're getting everything you need for health, that your energy balance going in and out is level. And so today, I'll be talking mainly about more generic healthy eating advice. And I just want to say that if you have seen a dietitian and had individual advice previously, that really supersedes this because that's tailored advice for you. So the Eat Well Guide shows the different types of foods and drinks that we should be eating and in what proportions to have a healthy, balanced diet. And really, you need to think a bit about it as your diet as a whole. It's not that every plate of food needs to look like this. It's about the whole week in your diet. So I'm going to talk about each of the sections in turn to explain a bit about what that bit is for and how much of it you need. So the green section is your fruit and vegetables, and those are really important for a variety of reasons. They're a good source of fibre, which is good for healthy bowels. You've got your vitamins and minerals, and there really isn't probably many processes in the body that don't need some sort of vitamin and mineral involved in them to make them work well. And then they've got things like antioxidants in them that can protect you from heart disease and cancers, so they're worth, having in the diet and having plenty of them. We should be having about 5 portions a day. But more recent evidence is suggesting it should be as high as 8. But in the UK, studies from 2017 and 18 show that only about 55% of people actually manage to get 5 portions of fruit and veg a day. So I think whilst we might recognise that more would be better, if people aren't getting what's the current recommendation, I think that's probably why it's staying where it is. So what counts as a portion? So, is it fresh only? Or can fresh, canned, dried, frozen all count towards your portions? What do people think? Anyone going to be brave? All of them, exactly, that's right. So fresh, frozen, dried, canned, all absolutely fine. What about things like fruit juice and smoothies? Yes, no? Show of hands for yes? You're right, absolutely. But it is a really small amount. It's 150 mils, which is a tiny little glass of unsweetened fruit juice or smoothie. And that can still only account for 1 portion a day. You can't have a glass of fruit juice with each meal and say that's 3, even if they're different fruit juices. The idea is that it's just the one. And that's because when you break that fruit down, the sugar's released more easily, you don't have as much fibre in it, so it doesn't necessarily have quite the same health benefits as a whole piece of fruit. But otherwise, a portion of fruit would be about 80 grams of fruit or veg or 30 grams of dried, and that's not very helpful, I don't think, if you haven't got weighing scales in front of you. So I think these images are probably a lot easier to try and sort of pick through. So a piece of fruit that's sort of handheld, like a banana, apple, pear, orange, is 1. Smaller fruit, like apricots, plums, those sort of things, you'd have 2. Things like salad leaves, 2 handfuls. 1 handful for things like grapes, blueberries, berries, that sort of stuff. Things like broccoli or cauliflower, sort of 8 florets. Things, bigger fruits like pineapples, melons, they say, the top of your finger, this sort of bit is about a slice of it. So it's probably just under an inch, I'd say. Peas, sweet corn, carrots that are chopped up, 2 to 3 tablespoons. And then your dried fruits, bigger ones, 2 to 3, like figs, prunes, apricots. And then the smaller ones like currants and raisins, 1 to 2 tablespoons. So hopefully that gives you an idea of sort of what you're looking at for a portion. And I'd say, if you're feeling inspired to go home and have a good count of what you're doing, the British Heart Foundation has really good resources online that you can download. So lovely pictorial information. So if you want more info, I would say that's a really good resource to go and look at. So next up is our yellow section, the other big section, and that's your starchy foods known as carbohydrates. And these are sometimes referred to as staples. They're a really good source of energy, and they're a source of a range of nutrients in our diet. What they do is they slowly release energy sort of over a longer period of time. And as well as that, they contain fibre, calcium, iron, B vitamins, and flour in the UK and cereals tend to be fortified with additional vitamins and minerals. So they're good sources of a range of nutrients. If you're having too little carbohydrates, then it might affect your overall vitamin and mineral intake, but also your energy levels, feelings of tiredness through the day could be worse if you're not having enough of those. We do recommend that you have whole grain versions. They will fill you up more and they release that energy over an even slower period of time. So if your goal is to gain weight, then probably these sort of foods, the whole grain carbs, might fill you up a bit too much. But if you're aiming to lose weight, then they're going to fill you up for a longer period of time and they're going to be really good for you. So that's maybe an example of where you take this advice and you apply it to yourself depending on your sort of personal situation. Some people who've got inflammatory bowel disease might find that whole grain, wholemeal versions don't agree with them as well, particularly if they're having a flare. That's fine. You go for the sort of refined versions if you want to. You might find that when you're not in a flare that you can manage those choices. So again, it's really about individual decision. And again, what counts as a portion here is slightly different for men or women. Anyone got any idea of how many portions of these you should be having a day? No? Well, I just heard someone say, what's a portion? So for men, it's 8. For women, it's 7. And these are examples of a portion. So they might be a bit smaller maybe than people think. So for something like a potato, it's a hand. Cooked pasta, 2 spoonfuls, 1 slice of bread. So if you're having a sandwich, that is 2 of your 7 or 8 portions a day that you've used. I'd say carbohydrates are really quite topical in the media at the moment. They've come under a huge amount of criticism. People think that having carbohydrates and starchy foods is fattening, but gram for gram, they contain half the fat of proteins or carbohydrates. And I think probably people maybe do consume more than the recommendations. And I think if you know what the recommendations are and you know what a portion size is and you're eating within that, probably then you're not having too much of them. Any excess calories, whether they come from carbohydrates, fats or protein that aren't used will get stored as excess body weight. So it's just important that you realise that there is a role for these foods in the diet, that cutting them out does have sort of potentially negative consequences, and that they potentially will cause you to gain weight, but that might actually be what you need, so they could be a really good choice for you. And again, British Heart Foundation's got a fab website. It's got loads of information. And if those examples of portion sizes I put up there aren't the kinds of things you eat, there will be information on that website to help you. So the next section, I'm going to skip over the really thin slither and go to the blue section, which is your dairy or dairy alternatives. And these are really calcium-containing foods. They're also typically a good source of protein and B vitamins. And really, calcium's important for, along with vitamin D, for bone health. These foods can be high in calories, so if your goals are not to gain weight or to lose weight, then you might want to pick lower fat and lower sugar options. So as I just said, for bone health, calcium and vitamin D are the kind of two nutrients we think about most for bone health. And there is an increased risk of bone disease in all liver diseases. So depending on the stage of your liver condition, around 30 to 55% of people will suffer from osteoporosis. And that's a term that's used to describe weakened or fragile bones that are prone to fractures. So if we think about PSC, patients do have an increased risk of developing osteoporosis. That risk seems to be higher with increasing age, if you've got a lower body weight, and also if you've got a diagnosis of inflammatory bowel disease in combination. And so because of that, there's a recommendation that your clinical team should be screening you. They should be looking at your risk of bone disease and then appropriately prescribing a vitamin D supplement or calcium if you're not eating enough in the diet. And I've also got, I've got that written down there. I've also got the stuff for AIH, but I'll talk about that when I go and do this next door in a few minutes. And so the recommendation for calcium is 700 to 1,000 milligrams per day, and that depends on your gender and your age. But most adults would be nearer to the 700-800 mark. So how would you get that in your diet on a daily basis? Well, roughly 3 portions of dairy foods would pretty much meet that 700 mark. So those 3 portions there all have between 220 and 250 milligrams of calcium. So those 3 would make you hit that sort of 700 roughly. But we have got a lot of people opting to go dairy-free or with milk intolerances and things like that. So you can still get your calcium intake from those types of foods. You really need to make sure you're picking one that's calcium fortified though. They're not all fortified with calcium. And even when they are fortified with calcium, they may not have the same amount as dairy products like for like. So you do need to do a bit of investigation, label reading and making sure you're getting enough in. But for all of the different types of milk substitutes, there'll be ones that are calcium fortified. And then if you don't like any of those, then there are other things that you can get calcium from. So fish with edible bones are a really, really good source. So whitebait, sardines, you've got to mash the bones in though and make sure you eat them. You can get breakfast cereals that are fortified with calcium. Things like nuts and seeds tend to be quite good sources. Leafy green veg, you can get fortified breads, and pulses tend to be a reasonable source as well. And is there anything else you can do to help your bones? Yes. Activity, particularly weight-bearing exercise, where our feet and our legs are supporting our body weight, are really good for bones. It could be, running, but if you're not really down for that, a bit of skipping or dancing or even brisk walking will do the trick. You need to aim for about 2.5 hours a week, and then muscle strengthening exercises a couple of days in the week as well. And those are the sort of things that if you don't feel you can reach those targets of that much, just more than what you're doing will always be better. Next thing is the vitamin D. So sun is our main source of vitamin D, but there's obviously risks associated with sun exposure, like skin cancer. There's a consensus statement that's been drawn up that represents the views of a variety of organisations, including people like Cancer Research UK and the British Association of Dermatologists, and they suggest that casual exposure to sunlight is enough to produce enough vitamin D sort of in the summer months. You can't really give a one-size-fits-all guidance for this because there's just too many factors that affect this. So the amount of UVB sunlight varies seasonally and at the time of day. Physical characteristics can affect vitamin D, so darker skin requires longer UV exposure. Older people have a reduced ability to make vitamin D through their skin. And safe sun exposure, which means not burning, is really very variable for all types of skin. Certain medications can also make you more prone to burning and increase sun sensitivity. So although the recommendation's quite vague, they say that really it is a matter of minutes of, arms and face in the middle of the day in the summer months could be enough. But if you're in a sort of situation where maybe that's not safe or not culturally acceptable for you, then you could think about a vitamin D supplement. We know between October and March, however, that there isn't enough sunlight. I'm not even sure there's enough in Wales in the summer, if I'm perfectly honest. But, you know, depending on where you live, if you live in Cornwall, you could be all right here. But between October and March, there's definitely not enough sunlight. So we need to eat more from the diet. So I don't know how well that's projecting, but it's like oily fish is a really good source, fortified spreads, dairy foods, eggs, and mushrooms, particularly mushrooms that are grown under UV conditions, can have extra vitamin D in as well. I've not actually seen that on a label, but, you know, you could probably try and find out. And then... Oh, excellent. You can get them in Aldi, so there we go, that's great. And then lastly, smoking, you know, among many negative effects on the body, it has a negative effect on bones. We're always told to make every contact count. So if you're still smoking, it's a really good thing to stop for your bone health. And we'll leave that there for you. So if we keep moving around in a clockwise fashion, we get to our pink sections. That's your beans, pulses, fish, eggs, meat, other proteins. It's essential for growth and repair of the body, maintenance of good health. It's a source of vitamins and minerals, including iron, B vitamins and zinc, magnesium as well. So, you know, there's lots of good reasons to have your protein foods. Pulses like beans, peas, lentils are really good alternatives to meat. They are a good source of protein, but they're also lower in fat and higher in fibre, so it kind of fits with the general healthy eating sort of framework better. And they're really cheap as well. So, like, you know, I'm conscious of the date and I'm worried the cost of food is going to go up in the future, so you might be wanting to get a few more of these things in your shopping bill. As a general population, we should be going for 2 to 3 portions a day, and there's some examples of portions. But if you've got more advanced liver disease, or if you're older than 60 or 65 years, the criteria for protein changes and you should be eating more. I'll talk about that a bit later. It's healthier to pick lean cuts of meat, and it's healthier to pick less processed meat, so avoiding things like the bacon, ham and sausages. You can include them, but just, you know, have less of them. You should be having 2 portions of fish a week, and one of those should be oily fish, salmon, mackerel, that kind of thing. And then we've got those portion size images come from the British Heart Foundation website as well. And again, the interesting thing about the protein portion sizes, it's not the protein content that sort of dictates the portion size, it's the energy content of the protein food. So in the first picture there, those are all different types of mince, but they're all 1 portion of protein because they all contain the same calories. So again, this is about interpreting the information in a way that suits you. If you've got a really little appetite and you're not managing to eat well and your symptoms are meaning that you're sort of undernourished, then actually, calorie-wise, the mince on the left, which is just bog standard mince, is a smaller portion for the same amount of energy. Whereas if your goal is to try and reduce your weight, then on the right-hand side of the picture, it's corn mince. So you can have a much bigger portion, feel full, and hopefully have less calories. And the same with the sausages. You've got normal sausages, reduced fat, and then corn sausages, and you can see the portion size varies, but that's all classed as 1 portion of protein. So I think, again, it's about using the Eat Well guide, interpreting it for your own needs and diet to make sure you're getting what you need. Okay. So there's a few little things on here that we haven't really talked about, so I'm going to go through these now. So in between the blue and the yellow, there's a really tiny purple section, and that is your fats and oils. So a small amount of fat is essential as part of the diet. It's an essential source of fatty acids which our bodies can't make. Fat-soluble vitamins like A, D, E and K, and we've just talked about vitamin D and how important it is for bone health, you can't really absorb them if you're not having some fats in the diet. But we do also know that it's got twice as many calories as the carbs and the proteins. And so if you're having too much of it, then you probably will end up with too much energy going into your body that isn't being used, and that gets converted into body fat. So that's why this slither is there. It is essential, but it is the tiniest little section. The healthiest fats are unsaturated fats. So broadly speaking, they're split into saturated or unsaturated, and saturated are the animal fats, and they're the ones that tend to be worse for heart health. Then you've got your unsaturated fats, which tend to come from plants or fish sources. You'll see them as labels on food labels as polyunsaturated or monounsaturated fats, and they're meant to be healthier for the heart. It'll be things like oily fish, olive oil, rapeseed oil, sunflower oil, avocados, and some nuts as well contain good sources of these fats. Then over here in the bottom left, you'll see this little collection of foods, and it falls outside of the main plate model, because even no matter how bad your day has been, we can't ever say these are essential in the diet. You might feel on a Friday night after a bad week in work that chocolate really is essential, but it isn't. They're nice treats, but they're not essential. So it's about them being taken smaller as part of that overall balance in the diet. No food is wholly bad. No food is wholly amazing. It's all about that balance. And I think the message that we always try to say as dietitians is that food isn't just about survival. It's not just about keeping your machine going. It has social aspects to it. You know, lots of people, demonstrate love by cooking a meal for somebody. There is a huge part about our connection as humans about food. So it's really important that it isn't just about the nuts and bolts of it all and keeping you going, but it's about enjoying life, and it's a huge part of quality of life too. And then lastly, top right, we've got fluids. So the recommendation is to consume 6 to 8 cups or glasses of fluid a day. These should be non-caffeinated and non-alcoholic. So you can drink caffeinated drinks, but you don't include them in this. And so you should exclude tea and coffee from your count. And if you've been advised by your clinical team that it's safe for you to drink a small amount of alcohol, then again, you wouldn't count that in this count. But hydration is really important for just feeling well, and energy levels too. So moving on past the healthy eating, one of the sort of key symptoms that Martine was talking to me about was people report feelings of nausea, feelings of sickness. So these, again, they're not specific to liver disease. They're just kind of the things we would say generally to people if you're feeling sick. So eat little and often, small, tasty amounts that you really enjoy, and then you build on that. Plainer foods that aren't sort of strong smelling or really spicy, you'll probably find those a bit easier to take. So even if you like a good curry, it might not be that if you're feeling really sick, that's the best thing to have. Plenty of fluids through the day as well, and sipping through a straw might be helpful because it keeps your nose away from the drink, and actually the smell of food is sometimes what makes us feel more sick. You might want to freshen up your mouth before you're going to eat, so clean your teeth, mouthwash, chewing gum, that kind of stuff, just, it's to sort of cleanse everything and make you feel ready to eat. Cold foods have less odour than hot foods. So again, if you're feeling like the smell of food's making your stomach turn when it's cooking, then maybe try and have some cold foods. You might want to think about how you're eating. So relax, take your time, be comfortable. If you've got a really tight pair of trousers on and you're feeling sick, then don't sit down and try to eat. Put something comfy on and try and get the best sort of position, really. You might want to have some fresh air prior to meals. Have a little walk, get your weight-bearing exercise going, and try and build some appetite and get that fresh air to clear that nausea. I'm going to talk about ginger on the next slide, and then I think really that if you're feeling sick and that nausea is making you feel so bad that you're not eating and you're losing weight, then you really ought to be speaking to your doctor or your specialist nurse about whether you need to have some anti-sickness medication just to help you through that. So ginger, it's sort of a medicinal remedy that's been used for centuries, particularly in Chinese medicine, that maybe has anti-emetic properties or anti-sickness. But there isn't a huge amount of research. It's not necessarily well-designed research, and it's certainly not big trials either. So this paper here that I've just done a little screenshot of, it's a systematic review, which means the research has been interrogated by experts, the results have been pulled together, and then they look to see whether or not whatever it is effective. And the 6 trials that went into this, the results really varied. So some said that ginger was better than a placebo or a fake ginger. Some said it was actually as good as prescribed anti-sickness. But when they pulled all the results together, it was not significantly better to take ginger. But interpreting this in clinical practice is quite tricky. None of the studies were about liver disease and sickness in liver diseases. And just because research wasn't included, it just means it didn't kind of meet their strict criteria. It doesn't mean the stuff that wasn't included wasn't good research necessarily. Importantly, there's no adverse reactions reported to ginger in any of these research that was included in this or from the British Herbal Compendium. So I think I would surmise from that it may not be of benefit to everybody, but it might be worth a go if you feel sick and if you like the taste of ginger. And I certainly found it incredibly helpful when I had hideous morning sickness that went on all day long when I had my children. So fatigue was the other thing people wanted to maybe know about, like was there anything diet-wise that could help with fatigue? Unfortunately, there isn't really a specific food or a magic diet that's going to help you with fatigue or that has any research or evidence base behind it. I think the point is the Eat Well guide is about ensuring a balanced diet and that deficiencies in a whole variety of food groups or vitamins and minerals can result in you feeling tired, having low mood and fatigue. And I've just picked literally a few because I couldn't possibly go through all of them. But if you think about protein foods, we've talked about them being for muscle strength, for tissue growth and repair. And if you're not getting enough of those, you're probably going to feel weaker and more fatigued over time. If we think about our energy foods, our carbohydrates, if you're not having enough of those and getting that long, slow release of energy through the day, then you're going to have waves of energy and that's going to make you feel maybe more tired. Vitamin D. So we've already identified that there's a significant population in the UK that have low vitamin D levels, and that's higher probably in people with liver disease as well. And although it's about bone health, what we've talked about already, low vitamin D is also associated with poor muscle strength, depression and fatigue. Iron, B12, folate, they're all found in different sources in that guide, but all of them, if you're not having enough, can result in forms of anemia, and the results of that are going to be tiredness, lethargy, fatigue. And then lastly, hydration. If you're not getting enough fluid through the day, and I'm definitely not at the moment, that can add to feelings of tiredness as well. So, think about the fact that all of these are about building good energy levels in you. They all have different aspects of it that build to make you feel healthy. So next up was dietary myths. So this is my life in clinics all the time. There's just a ridiculous amount of information on diet, complementary medicine and alternative therapies on the internet, with lots of people offering advice and organisations offering advice. And I think, when you've got a condition and you're looking for something, you totally can understand why people sort of go down these routes. What I would say is typically, if you follow the clickbait and go through, there's going to be somebody maybe trying to sell you something, maybe trying to make you to buy something. It's an industry for them. And the headlines are designed to draw you in, and they do. There is no solid evidence base for any of these types of diets in the general population, let alone specifically in liver disease. So I think the message would be, please don't be tempted to go down the route of any detox diets or anything claiming that it's a cure for a condition without discussing it with your clinical team, because the chances are that they'll do a good story in selling you about the evidence base for it, but it won't be the kind of evidence base that we would talk about as health professionals. There is a slightly less publicised secret in detoxing, and I am going to share it with you today. Your liver and your kidneys, they are the two organs in your body that get rid of waste products. So living your best version of a healthy lifestyle, looking after your liver, it really is the best way that you can try and keep your body healthy. Quiz time again. Does anyone want to tell me which of these is a superfood? I see. None of them is the answer. They're all good for you. Superfood's a marketing term, it's not a scientific term. So these are all great for antioxidants or protein or whatever, but then so are loads of other cheaper foods. And as soon as something's branded as a superfood, the price tends to go up. Blueberries are really good for antioxidants, but so are kiwis, so are oranges, So don't feel that you need to suddenly swamp your diet with loads of these different foods in an attempt to sort of be healthier. Eat them if you like them, but there's going to be other versions, probably cheaper, that will do the same job. And there's a risk that if you take loads of one thing in an attempt to get loads of a particular vitamin or compound, it's going to be at the expense of something else. So think about that balance overall. So we'll talk a little bit about herbal remedies as well. So I think people assume that a plant that's used as maybe a herb or a spice, that it's safe and it's free of serious adverse effects. But that's really dangerous to assume. A small amount of a spice in cooking might be safe, but if you're taking it in mega doses in like a concentrated capsule, that might not necessarily apply. And herbal and dietary supplement-induced liver injury now accounts for 20% of cases of liver toxicity in the United States. So I think you need to remember that herbal medicines and over-the-counter dietary supplements, they're not regulated through large clinical trials in the same way that prescribable medications are. And many of the complementary and alternative medicines that are promoted say they benefit the liver, or they might treat symptoms of liver disease, but in fact, they might actually be toxic to the liver. So I think really the message is, while there's more research awaited, that these products shouldn't be recommended. And if you are taking these things, your doctors will often ask you, are you taking anything over the counter? They mean this sort of stuff as well, if you're taking any herbal supplements, because they do need to know if you're having those sort of things. So a bit about coffee. I don't know if any of you have heard about coffee. There's quite a lot of studies actually showing that across a variety of liver diseases that moderate coffee drinking might have a positive effect on limiting the rate at which diseases progress. But the actual reduction in risk for liver cancer, cirrhosis and chronic disease, liver disease is variable, and we don't really understand exactly what mechanisms are at play. There's several components of coffee that might be responsible for the effect, but it's not entirely clear what are the active ingredients. Caffeine is thought to play a role, so maybe decaffeinated doesn't maybe have the same impact. And there's sort of research that suggests that it doesn't matter what type of coffee it is. I don't mean like latte or like cappuccino. I mean like, like filter coffee or sort of dehydrated coffee. But, we need to interpret the evidence base carefully. The studies are small numbers. There's some flaws in the designs of the study, and there's very little specifically on PSC. So I think we need to remember as well that caffeine's a stimulant, and that for some people drinking lots of it can make them a bit irritable or have problems with sleep or rest, anxiety, and for some people it can give them sort of gut symptoms as well. So, I think at the moment, maybe the takeaway message is that, if you want good liver health, things like reduce the amount of alcohol we drink, eating a balanced diet, having plenty of fluids, exercise, keeping a healthy weight, those sort of things are still the key messages. But if you like coffee, then potentially drinking 3 to 5 cups a day might have a benefit, but it's not at the expense of the other health messages. And I wouldn't be sitting there thinking, if you don't like coffee, I must start drinking it. At the moment, we're probably not in a situation where we may be saying you must be doing this, but it could be helpful. And then I've got a little bit about if you're struggling to lose weight. So hopefully what we've talked about already will give you an idea of sort of what the overall diet should look like, and some tips if you did want to lose weight about how you might do that. But to be honest, we often see charts like this about like balance, and it's a really simplistic view of weight loss. It's not just about what goes in and what goes out. That is right, but we're understanding all the time the complexity of this in people, and the genetics that are involved are way beyond sort of the scope of this talk today. And that what a healthy weight is for everybody means slightly different things. So I think as dietitians, we talk a lot more about that stage of change and where you are and whether you're ready to change. Just because we know we should be doing something, it doesn't actually mean we can do it. We need to be psychologically ready to make a change. And the challenge of weight loss is as much a mental challenge as a physical challenge. So I think lots of people think going to see a dietitian is about being told what to eat and getting a telling off. But actually, my colleagues that work in this field, that are experts in it, they're much more about where are you, how can we move you on, how can we get you through these different stages to the point where you can actually make changes and then sustain those changes over a longer period of time. So I think if you were thinking that's something you wanted to do and you felt fearful about going to see a dietitian, don't at all. We're really nice people, promise. I think my tips would be realistic. You know, if you want to lose weight, but you may be on a medication that's making you hungry and maybe retain or gain weight, then maybe you should just be aiming to keep it stable rather than actually trying to lose weight. It's about being a bit kind to yourself, and maybe when you're stopping the medication, then think about doing it. Secondly, if you've been struggling with this sort of thing for a while, try to avoid the crash dieting and the fad diets and the cleanses and the detoxes for the reasons I've already discussed, but also these are a quick fix to a long-term problem and they can be risky to your health. So really what you want is a long, sustainable change that is going to keep you going for a long time. And then, as I've said, if you're really struggling, ask to see a dietitian. There is probably no primary care trusts or health boards in Wales that don't have some sort of service for this. And then we're going to move on to advanced liver disease. I haven't had my 5-minute hold-up sign yet, so I'm going to keep going. What are you doing? Come on, Martine, you're meant to be on it. Oh, yeah, we're fine. So if we think about advanced liver disease, everything I've told you just, ignore almost, that it is a complete turnaround at that point, that there are changes in dietary advice at that time. I don't know why that's not come up, but there we are. So at that point, when liver disease is progressing, good nutrition is a really important part of your care plan. It can stop muscle wasting, it can maintain strength and mobility, it can reduce admissions to hospital, it can speed up your recovery from procedures and infections, and it can actually help to prevent some of the complications associated with advanced liver disease. So at that point, really, the advice is a change. Patients do tend to lose weight, and they specifically lose muscle stores. And this is because our spare energy from carbohydrates is stored in liver and muscle tissue as something called glycogen. And when we go into a fasted state after eating, which is typically 2 to 4 hours after we've eaten something, then our body would use those glycogen stores to refuel us almost. And the body needs energy 24 hours a day. Even when you're sleeping, your brain function, your lungs working, it takes a huge amount of energy. And so when you have liver disease, you probably don't have those energy stores. And that's why we tend to waste our muscle, because our body needs that energy. It can't just shut down and close down. So it will burn your muscles for fuel instead. So it's really multifactorial, the malnutrition in liver disease. So people do tend to develop reduced appetites. That's part of the condition. People tend to feel full if your liver's enlarged, or if you've got something called ascites, which is fluid around the tummy. It can make you feel really full. We, at that point, are probably definitely getting some poor digestion of fats. We're not maybe breaking down fats very well, and so we're getting malabsorption there as well. And then we've got these reduced energy stores, this reduced amount of glycogen available. So all those things combined mean that we're probably at that point of time going to be losing weight. And even if you physically don't feel like your weight is low, we have patients who have really high body mass indexes and are overweight, but they have a huge amount of muscle wasting. And that still is a really poor in terms of their prognosis. So we definitely want to keep you well at that time in terms of your muscle and your weight. So we say to eat regularly every 2 to 3 hours. So it's about kind of grazing through the day more at that point. And that's about replenishing those carbs constantly through the day, so you're not burning your muscles instead. We talk about a big bedtime snack. So we talk about a snack, but it's not really a snack, it's really a small meal. And we want it to contain at least 50 grams of carbohydrate. That seems to be the sort of minimum amount that's been shown in research to be sort of protective for your muscle stores. So an example would be like a half pint of milk and maybe 3 biscuits, 2.5 slices of toast with some butter and jam, or cereal with milk and a banana. So it isn't a small amount we're asking you to have at that time. And then lastly, we really want you to have much more protein at this time. So we talked earlier about 2 to 3 portions a day. You should be pushing up to 3 to 4 minimum, really, at that point. And then there's some tips now for if you're losing weight. And I think as well, if you're having like an acute flare-up, really, or like an infection, then these are the sort of things that you can do at that point to make sure you're keeping nutrition good. So eating little and often, pick nutrient-dense foods. So this is a point where we want high calorie, high protein, and the fruit and vegetables that we talked about earlier that are so good, they're very low in calories. So do not have as many of those at that point in time. Focus more on those carbohydrate and protein foods. Snacks snacks between meals, nourishing drinks. So water hydrates, but milk hydrates and gives you protein and energy. So that's a good swap. And then you can have things like nutritional supplement drinks, and you can buy over-the-counter versions, or you might get one prescribed by your doctor or your dietitian. And at that point, you probably do need to be seeing a dietitian. I'm nearly there. So there's no specific diet for PSC. That the dietary advice depends on the stage of liver disease. If you're in the early stages, it's all about that healthy eating and exercise. Eat a rainbow, aim for a healthy body weight, look after your bones, they hold you up, they're really important. Avoid herbal and dietary supplements that aren't sort of like recommended by your team, and try not to go down the route of special diets that don't have sort of scientific evidence to support them in liver disease. Coffee might be helpful. And then as disease progresses, regular meals, nourishing drinks, bedtime snacks, it's a little chant that I do with my patients because it's just so incredibly important at that time. Focus on high energy and high protein foods, reduce the intake of those lower calorie foods, and you're probably going to need nutritional supplements. So hopefully that gives you a clear idea of who should see a dietitian. Anyone who's got uncontrolled weight loss or a really low body weight, if you want support with losing weight, if you're struggling to manage the diets of two conditions that have possibly opposing dietary recommendations, go and see a dietitian because we can help to kind of prioritise which bit is the most important bit to follow at what part in your life. And then any other sort of specialised diets that might need to be adapted or sort of tailored to suit individual circumstances. And then lastly, that's the references and resources I've used today. It's really important you know that we use an evidence base when we talk to you and that it's not just stuff we've made up or, you know, read on the internet. So, yeah, those are the resources I've used today. And are there any questions?